The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanic, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Welcome back, TMD Warriors. We are gathered for the next episode of TMD Demystified. My name is Tony Urbanic. I assume most of you already know that. Today, we're going to be talking about a very important topic. To you, I would imagine that not many of you are even have any idea of the possible complications that can occur when misdiagnosing certain diseases, one for the other. But in our case, TMD can be misdiagnosed as many other diseases and treated as such until the treating doctor, physician, chiropractor, dentist finally concedes that the symptoms actually may be TMD. And I've talked about that many times before and discussed it specifically to the misdiagnosis of migraine headaches and what occurs when migraine headaches are treated for decades when the problem is actually TMD, or ear infections that are misdiagnosed constantly, usually coming out of convenient care clinics, walk-in clinics, that any kind of ear pain is diagnosed as an ear infection, treated with antibiotics, which obviously will not do anything for the inflammation of the temporomandibular joint and the actual cause of TMD. And then, of course, there's Meniere's disease, which is misdiagnosed constantly by the ENT surgeons without consideration that the ringing, fullness, dizziness in the ears are caused by inflammation from in the temporomandibular joint, which gets into the middle ear, creating those symptoms for sure, which is known as Meniere's disease, ringing in the ears, subjective hearing loss, and fullness in the ears, and dizziness. But misdiagnosing any of those three diseases is usually doesn't come with a potential of life-threatening complications and problems. But this last one that I'm going to talk about today does. And that's why it's important for anyone who treats TMD, whether it be with the Urbanic device and protocol or any other method at all, be familiar with a medical condition, disease, problem called Chiari malformation. Chiari malformation, Chiari, Chiari malformations. Actually, there are 4 separate types of Chiari malformations, and in a minute I'm going to go over all 4 of them. But the most common type of Chiari malformation that is confused with TMD, TMJ, is type 1. So first of all, let's define Chiari malformation. There are 4 types of Chiari malformation. The most common is Chiari malformation type 1, which occurs when the lower part of the cerebellum, that part of the brain responsible for movement and balance, pushes through or herniates through the large hole at the base of the skull, which we all know is called the foramen magnum. Normally, only the spinal cord passes through the foramen magnum. However, when part of the cerebellum herniates through the foramen magnum into the spinal canal, symptoms similar to TMD, TMJ can occur. Chiari malformation types 2, types 3, and types 4 are more severe types of malformation and are very unlikely to be confused with TMD TMJ. That was read directly off of this week's blog, which I write once a week for the public. So I am attempting to write a blog once a week, which I've already told you that goes to the public, and a podcast once a week that goes to my compatriots in the profession, but trying to cover the same topic for the week. So this week's topic is dangers of misdiagnosing TMD, TMJ as Chiari malformation. So now you know what Chiari malformation is. Now I'm going to try to screen share a diagram of this to drive it on home. On this enlargement from a smaller photograph that I picked off the internet. But on the left, you can see an MRI of a normal cross-section of the brain. This area here that I'm pointing to is the cerebellum, which is the primary portion of the brain responsible for balance. And the foramen magnum is right below the cerebellum. And then off the bottom of the cerebellum comes the brain stem, which you cannot see in this cross section. You can see the brain tissue here, the lobes of the brain, but you cannot see the brain stem itself. But in this cross section of a patient with diagnosed Chiari malformation, you can see the herniation of what are called the tonsils of the cerebellum, the inferior portion of the cerebellum through the foramen magnum right here. Here's the edge of the foramen magnum, and here's the herniation through, and here's now the brainstem coming down, which was not able to be seen on this cross section. But this is the herniation of the cerebellum, and this would be classified as a type 1 Chiari malformation. Now, before we go any further, let me just briefly go through the other types just for completeness, because you will not see a misdiagnosis or misunderstanding between TMD and the other three types. But type 2 Chiari malformation is a congenital problem where the spinal cord does not completely close. And it is actually designated as a myelomeningocele, which is actually an opening at the back of the spine, which is a congenital problem and never going to be confused with TMD. It's anatomically so obvious. The third type is actually the brainstem, and the cord pushes through the back of the neck. So this is a congenital problem, and infants born with this sometimes can be salvaged, but in most cases, they do not have a long life. And again, it's obvious from birth, but also classified as a Chiari malformation. And the fourth type is when the cerebellum does not form at all. It's maldevelopment or no development of the cerebellum, which would be classified as a type 4 Chiari malformation. So we are only interested in type 1. And you can see a good picture. Take a good look at this. And when I say Chiari malformation, this is the picture that you should bring out in your mind. So the problem is that the symptoms of Chiari malformation type 1 and TMD are very similar or identical. And here's what happens, and it's happened, and I'll mention at the end of this our experience here in this practice with Chiari malformation being misdiagnosed when the actual problem was TMD. But the symptoms associated with Chiari malformation are the following. headaches, neck and shoulder pain, dizziness, tingling of the arms, swallowing problems, and hearing loss, basically subjective hearing loss. I throw in there swallowing problems because it's one of the symptoms that I do not delineate on a constant basis because it is one of the lesser occurring symptoms that we have seen here associated with TMD. But we have seen enough in this practice patients who complain of swallowing problems when the actual problem is TMD, and I can tell you exactly how that works. When the mylohyoid muscle, other than say the masseter muscles or the other facial muscles, get the signal from the autonomic sympathetic system to tighten up. Remember, tighten up the muscles creates the pain. But when the mylohyoid gets the constant signal to tighten up, it creates tension and on the pharynx, and patients will complain because I've had them happen many, many times. They'll also complain of swallowing. It is just not that common. So I did not bring it out on the usual symptoms seen with TMD, which are headache, earache, jaw pain, neck pain, ringing, fullness, dizziness, upper back and shoulder pain, arm, hand, finger tingling, and numbness and locking. I do not routinely include swallowing with that, although I've had many patients complain of if I'm having trouble swallowing, it feels like I can't swallow normally. And again, I believe it's because the mylohyoid tightens up, easy to tighten up my neck, and and tightens up and puts pressure on the pharynx and possibly even the parapharyngeal muscles. I mean, it's, I can't prove it. That would take a very complicated independent study, but the muscles who get the signal to tighten up, and I believe it's striated muscles, not parapharyngeal muscles. In any case, that is one of the common symptoms of Chiari malformation, swallowing problems, and it is also seen in TMD. So let me repeat those. Chiari malformation, and this is what the doctors look for. The patient goes to a neurologist with chronic pain of the head and neck. And they go to the neurologist and he listens to the patient, and the patient says, doctor, I have these symptoms. I have chronic and recurring headaches, neck and shoulder pain, dizziness, tingling in my arms, swallowing problems, and hearing loss. And I've been checked out by the ENT doctors, and he can't find anything wrong with my hearing. My hearing's fine, but I have subjective hearing loss. Again, those symptoms are definite symptoms of TMD, validated, accepted symptoms of TMD. Headache, neck and shoulder pain, dizziness, tingling of the arms, swallowing problems, and subjective hearing loss. So the neurologist, now faced with this, he said, well, let's see what else we might find. And he gets an MRI. And he does a several $1,000 workup. And we're going to do this again for effect. And he gets an MRI, and he sees an MRI that looks like this MRI on the right. And he says, oh my God, you have Chiari malformation type 1. Now, the problem is that the patient will say, well, what can be done about this? Because these symptoms are ruining my life. And he said, well, there's a surgical procedure that can be done where the neurosurgeon goes in at the base of the skull and opens up the base of the skull and enlarges the foramen magnum, makes the foramen magnum bigger, makes it larger, so that it takes the theory behind it is that it takes the pressure off of the herniation of the tonsil of the cerebellum, takes the pressure off of it, and the symptoms will diminish. Well, the problem is that a lot of these, actually the majority of patients who have anatomical radiographic signs of symptoms, a radiograph showing tonsillar cerebellum herniation, are asymptomatic. So you can take a cross-section of the public and Chiari malformation is only seen in, it's only 1 in 1,000 people in the public have this malformation type 1, but almost all of them are non-symptomatic. So you can have this malformation type 1, and the majority of those patients are not symptomatic. They do not have symptoms. Now, that is a fact agreed upon in the medical scientific literature. But when the neurologist sees this malformation and symptoms, he thinks, well, you have a symptomatic Chiari malformation, at which point I'm going to refer you to a neurosurgeon. And the neurosurgeon can handle this problem by doing neurosurgery, opening up the base of the skull and enlarging the foramen magnum to take the pressure off the cerebellum. And that is the scenario that plays out not only around here in Middle Tennessee, but if it happens in Middle Tennessee, then I know it happens in other parts of the country and probably the world. Because we already have 2 cases and possibly a third where this problem has been misdiagnosed. I'll talk about that here in a minute or two. But this is the scenario that is actually a dangerous scenario, because neurosurgery is not without complications, not without problems. So that is the problem. So therefore, it's not surprising that patients are misdiagnosed and then directed toward neurosurgery to enlarge the foramen magnum. I looked up the average cost of neurosurgical care of Chiari malformation type 1, and it varies between $25,000 and $65,000 per case. And this is only the hospital expense. This does not include the surgeon's fee, which, I don't know, what does a neurosurgeon charge to do what is a very complicated surgery? What would that entail? $10,000, $20,000, $30,000. So you can add that to the list, plus knowing that the patient has a very long post-surgical tract, significant pain, significant medications, and then if it was been misdiagnosed, the symptoms continue. So that is the scenario that we have seen, that I have seen personally in my practice treating TMD within the past 3 or 4 years. I have seen 2 patients who have gone through Chiari malformation neurosurgical procedures that presented to my office after the surgery and after they have recovered from the surgery with continued symptoms of headache, shoulder pain, dizziness, hearing loss, and that obviously the Chiari malformation was misdiagnosed, and that the patients cleared and their symptoms totally improved by using a device that separates the posterior teeth long enough to decrease inflammation within the temporomandibular joint, which, once the chronic inflammation diminishes, which is the driving factor creating the symptoms, their so-called symptoms of Chiari malformation went away. It was definitely misdiagnosed, and the patients survived and did okay, although one of the patients had a rather stormy post-surgical problem. And actually, in her case, the surgery was done twice, both times without diminishing the symptoms. And that is why I elected to title this episode of TMD Demystified as Dangers of Misdiagnosing TMJ as Chiari malformation. This is not a one-off, and if you treat enough patients as we do here in our practice, you're going to see this. And, you know, how we handle it is, as we handle all our patients, letters are sent on a routine basis. I'm not picking on this neurosurgeon or neurologist, but this patient, when she presented to our office, as all our patients are, asked for a list of their doctors that have treated them for any reason in the past, as many as they can provide, their PCP, the walk-in clinic nurse practitioners, their dentists, their oral surgeons, their ENT, their chiropractor, the massage therapist, physical therapist. And we collect all those names. And as the patient goes through the protocol with the device, letters are sent out at each time the patient returns to the office for the device delivery or a check, post-delivery check. Letters are sent out to all of the doctors describing the symptoms and what percentage of those symptoms are not diminished or gone. So in the case of these two particular patients, as in all of our patients, they received letters from us describing the symptoms that the patient presented with, what was done for them, and what percentage subjectively they said what percentage of their symptoms were gone at each point in time. And so they were notified as to what occurred after their surgical intervention, which was not successful. And I think that is the best way to handle this without ruffling feathers too much, as we say in the Midwest, where I come from, or maybe in the South too, and try to do it as diplomatically as possible, which is the point. I think that all these, I mean, it's just they didn't know, and that's the problem with TMD. The doctors out there don't know. The physicians, they don't know. The ENT doctors don't know. The ENT doctors misdiagnose it as Meniere's disease, and the walk-in clinics constantly misdiagnose, TMD symptoms as migraine headaches, and their ear pain is ear infections. And the best way to correct this is to send out those letters on a routine basis. But this one, I am sure that if we're able to investigate long enough in different parts of the country, you're going to find patients who were misdiagnosed and mistreated as Chiari malformation that had significant complications, if not worse, due to a rather complex neurosurgical procedure, which was not necessary. That's what I have to say for today. I hope you take it in the light that I give it, as information to help my medical colleagues, to help my dental colleagues understand TMD, to understand the seriousness of actually correctly diagnosing TMD and being able to have a treatment plan and protocol, and in this case, a non-surgical device that does a fantastic job of diminishing the symptoms without TMJ surgery. And as you all know, I was a very active TMJ surgeon with over 2,000 TMD surgical procedures under my belt. On the other hand, when you understand that the whole problem is driven by inflammation within the temporomandibular joint, and if you can diminish that inflammation in any way possible, that you will diminish the symptoms. Now, the best way to diminish the inflammation is to unload the temporomandibular joint long enough to allow the inflammation to go away, like a set of crutches unloads a knee that is inflamed. Non-steroidals work really good for a short period of time, but Botox doesn't unload the temporomandibular joint. Botox paralyzes a particular muscle or muscle set, but it doesn't decrease. It doesn't the inflammation within the temporomandibular joint. It just paralyzes the muscle and allows the inflammation within the temporomandibular joint to continue. I'm going to address the Botox thing. A very, very interesting article was just published in the Journal of the Oral and Maxillofacial Journal of Oral and Maxillofacial Surgery this month, which I am going to discuss in the near future, maybe next time, regarding the use of botulinum toxin in comparison to other things. Very interesting. I'm not going to give it away. but I think this is stunning, absolutely stunning. So that's enough. I think this is a little short one for today. I hope you gathered something from it. I hope I presented it well enough for you to remember it, take it home, use that information if necessary. I'm here to help. I'm here to educate. I'm here to actually solve this problem in the dental establishment for the dental profession and the medical profession. If you'd like to learn more about this, you can go to our website, which is www.urbanictmj.com. To remind you, we have here at the end of the month, April 19th, 2024, we have our first professionally placed, because the others that I did earlier in my career were very unprofessional, out of the waiting room, but now we have our first professionally done seminar, all-day seminar on the TMD problem and the solution for TMD. It's here in Nashville, Tennessee. If you'd like to learn more about that, you can contact our Director of Marketing and Education, and Dr. Naomi Williams. Anyone is always welcome to contact me at my email address, which is tony@tmjservices.net. If you have questions, if you have criticisms, don't hesitate to send them my way. I have a story on that even. I get no criticism. I can't generate a criticism after 140 some episodes on this podcast. And so I encourage comments and criticisms if you'd like. So for today, I look forward to the next time I'm able to speak with you. It will be on a Tuesday morning. It will be on a weekly basis. And I will see you next time. This is Tony Urbanic, TMD Demystified.